Hey guys, welcome back to my channel. If you're new here, my name is Rebecca and I'm a stay-at-home mom and an online reseller. And in today's video, I'm going to be giving you a second trimester of pregnancy recap and kind of like a 30-week pregnancy update. So currently when I am filming this, I am 29 weeks and 5 days. I will be 30 weeks on Tuesday. Today's a Sunday. Just as an aside, I am sorry if I am like a little bit crooked. My tripod is a little bit crooked. I don't know why. It's always been like this. It's like my ring light tripod setup and it's just always a little bit off. So that's why it might look a little bit off, but I can't really fix it because if I try to turn it this way, then I'm really crooked. If I set it back like this, is straight on and then it just falls to the side. So I'm sorry, but I'm just going to be a little bit crooked today. So since I'm basically 30 weeks now, I have been in the third trimester for the last 2 weeks. So it started on the 28th week is when the third trimester starts. So I'm kind of in the home stretch, so to speak, the final trimester of this pregnancy. And if you're just joining me, I have 2 other kids. I have an almost 5-year-old. He'll be 5 in just a couple weeks. I have a 2.5-year-old, and this is going to be our third baby. And this baby is a little baby girl. So far in this pregnancy, there haven't been a ton of like big crazy things that have come up. It's kind of been like a fair amount of little things that have happened. So we have had a placenta previa diagnosis since the anatomy ultrasound around that 20-week mark. Technically still have that diagnosis. We haven't gone back yet. We have, I think, about 2 more weeks. And then we will go in for another ultrasound and they will check and see where my placenta is at that point. And that'll determine if we're going to need a C-section or if I'll be able to deliver naturally, which is what I'm hoping for. But I just had an OB appointment last week and my OB seemed pretty optimistic that my placenta will have moved. I think that's mostly because even though I was given a placenta previa diagnosis, I didn't actually have like placenta previa. It was really a low-lying placenta, and it probably just depends on like how close to the cervix, to the cervical opening that the placenta is lying as to whether they give you that diagnosis or not. But I haven't had to have any other checks or done anything pertaining to that as far as, except for the fact that they said I've been on pelvic rest. But other than that, and like limiting my exercise, but I haven't had any extra appointments or tests or anything like that. It's just a matter of if the placenta moves or not, because you can't move it on your own. So we're still waiting to hear about that. Like I said, should find out about that in about 2 weeks when we go back for our, it's like 32-ish week ultrasound. I've also been dealing with SPD this pregnancy, which is symphysis pubis dysfunction, which is kind of like a lot of pelvic pain, like they call it pelvic girdle pain. So it's kind of in the groin area, not like on the outside of the hips. It's definitely in the groin area. I still have that. I still go to physical therapy every 2 weeks for that as of right now. I have that scheduled out through the end of my pregnancy already because she said it's something that we're just going to have to continually manage. It may get better, may get worse, depending on a lot of it kind of honestly depends on my activity. Some of it depends on the way the baby's sitting or just the way my body's adjusting to the pregnancy. So right now, it honestly goes day by day. Some of the techniques that she does when I'm at therapy, that therapy isn't like I'm not doing activities. The therapy is like she's doing some manual techniques to help relieve some of that pain. I honestly don't understand all of it, but it does help. So last time it helped, and I actually was pretty pain-free for about a week before I started getting a pain again. I think a lot of the pain issues come from the way I'm doing things in my day-to-day life. So a lot of the therapy has also been us just discussing, like, when are you noticing that you're having pain? And here's some things you can do a little bit differently as far as like, you know, not taking large steps, taking smaller steps, making sure like my legs are moving together. Things like that. I've kind of discussed this in some other videos. So like if you go back and watch my other pregnancy updates, I kind of discuss it there, but it's pretty much still the same thing going on. Some days are better than others. I can tell when I've stretched that area too much. It's usually when I'm like rushing around, or if I pick up something heavier than I should. I can definitely notice that pain. But I'm noticing a lot of it, especially in bed. It's really difficult. Even trying to like, you kind of have to roll to get out of bed. But I also have a giant pregnancy pillow and it goes like the whole way around. So I can't really move it out of the way. So I have to go like up and over it to get out of bed. And our bed is up really high. So I'm definitely noticing more pain in bed as far as trying to get like in and out of bed to go to the bathroom in the middle of the night, which hasn't been too bad yet. I say I typically only get up like once, somewhere between like midnight and 2 o'clock usually to go to the bathroom. Sometimes it might be a second time or something like that, but that part has been okay so far. I haven't had to get up multiple times as of right now. So hopefully that won't increase too much in the following months. I did do my glucose tolerance test. I did that at 26 weeks. So I was having some issues with feeling very faint and sick in the mornings for a while. And my assumption was that it was because I was anemic, and that is pretty common in pregnancy. And it's also common for me just to become anemic throughout pregnancy. I've had anemia issues ever since I was like a teenager. It's pretty common, I think, among women in general. And definitely during pregnancy. Also, my prenatal that I take does not have iron in it because I take a gummy prenatal. They're just easier for me. I'm not great at swallowing pills, though I take quite a few pills, honestly, right now. But yeah, so I didn't have an iron in it. And the way I was feeling, it made me assume it was probably due to an iron issue. But they like wouldn't, when I called in, they wouldn't send me for blood work sooner. They basically were like, just wait till you're 26 weeks. At this point, I was like 25 weeks and a couple days. So they basically wanted me to wait till 26 weeks because I was going to need to get more blood work done. That's just like kind of a, not really a midway mark, but a time when they have you get a bunch of blood work done again anyway. So they basically kind of told me to wait till then. So I went and did that and my glucose tolerance test, the 1 hour, all at the same time. And certainly came back that I was anemic. They basically sent me like a message in my portal, and it was just like, you are anemic, start taking iron. And that was it, which I thought was like, maybe they should have given me a call or something. I guess it wasn't serious enough for them to feel like they should have to call me. Even though I was literally on the verge of passing out multiple times. So anyway, I've started taking an iron supplement. I only take it every other day, and that has been helping. I haven't had those faint, lightheaded feelings anymore, so that's really good. The glucose test, in case you're wondering, I think I chose the fruit punch flavor. We get to choose at our clinic, either, or at our lab. This time they had fruit punch, lime, I think it was lime, and then like an orange flavor. And my third pregnancy, I've had every flavor. It doesn't bother me. I know some people really get bothered by the glucose tolerance test by drinking that, and it doesn't bother me at all. It's just like really sugary. I get like a little acid reflux feeling from it. But other than that, I had no problems with it. Drank it right down, and then just waited an hour, got my blood drawn, and everything was fine. So I passed that, which is good. My last pregnancy, I did not pass. My first one, I think I was over by like 5 points. And I went ahead and did the 3 hour, which then caused other issues because I really shouldn't have even done the 3 hour. I was so close to that cutoff. In my opinion, I shouldn't have even done it because I actually got quite sick and my levels dropped quite low. But this time, everything was fine. Taking the iron now, so like I said, everything seems fine with that. So I don't think we have any more blood tests or lab tests, as far as I know, like coming up really soon. But we did talk about vaccinations. So I just got my Tdap vaccine at my last appointment, which I had to take my kids with me too because my mom, who usually watches my kids, got COVID. And I think this is like the third time she's had COVID, and she's vaccinated, but she still got it. So she was okay and everything, but obviously we didn't want to risk catching COVID. So we did not, I just took the kids with me instead of having someone watch them. And luckily it went really well. They did really well. and it was a fairly quick appointment. That was my 29 week. I think it went right on 29 weeks. So yeah, everything was fine. Tdap, got that, no issues, just a sore arm. I do need to get my flu shot here somewhere in the next couple weeks. And I'm trying to see if I can find somewhere that has a COVID booster, because they did say that it would be recommended to get that. I'm not looking forward to that just because I get quite sick after my COVID shots. Not my very first one, but all the ones after that. I got, I feel like I have COVID for like a day. So I'm not looking forward to that, but I do want to get that so, you know, the baby can get some of those antibodies, and just because I don't want to get COVID, especially while pregnant or while newly postpartum. So we're going to go ahead and try to find somewhere near us that has that, which I need to look into that a little bit more. At the last appointment that I had, they weighed me like they always do, and my weight came in at, I think it was like 161.5, which was up about 1.5 pounds in the last 2 weeks since my last appointment. Once again, they haven't said anything to me about my weight. I am still within that normal range of gain 25 to 35 pounds during pregnancy, so I'm not concerned, but I definitely have been having more body issues, I guess, just mentally. I try not to think about it, and I don't really pay attention to it too much, but there are just those times when it kind of like sneaks into your head, and it's hard. Like, I can tell that I'm, you know, gaining weight, like especially here, which is really frustrating. And especially like in my legs, I'm like waiting for it to get cold enough so I can just wear leggings, because I really don't love the way that my legs look in shorts and stuff like that right now, which, I mean, I'm growing a baby, you're gonna gain weight, like it's just kind of what happens, and I can't really work out because of the placenta previa and the SPD. So there's not like a whole lot I can do about it. I try to eat a pretty well-rounded diet. I'm not like a huge junk food person as it is. I'm definitely eating more. I'm hungry a lot. Baby needs food too. So I'm not terribly worried about it, but mentally it is just a little bit difficult to see those kinds of changes in your body and be like, I can't really do anything about it right now. And I'm not interested in like trying to reduce my weight, because I don't think that's healthy during pregnancy. But not in my case. That's just me speaking personally for myself. But yeah, so that's been a little bit difficult, but everything seems to still be like within the normal range. So at that point, I think I would have been up 27.5 pounds, I think, something like that. So still trying to stay within that like maxing out 35-pound range. Ideally 35 pounds of weight gain. You know, we have roughly 10 weeks left if baby comes right about the due date. So I think that's still like a good spot to be in. Baby supposedly weighs around 3 pounds right now. So my other two were born in the 7-pound range. So I'm expecting at least 4 more pounds of just baby weight. And then whatever else is going to come with that. One of the unfortunate things that happened this past week is that I actually got food poisoning, which I've only ever had one other time in my life. Food poisoning while pregnant, I will say, is definitely not fun. But last Sunday, it was the day before Labor Day, and we were at a cookout with my in-laws. And then when we came back, I decided to go and get groceries, which I don't usually do. I usually just do a grocery pickup. But this time I wanted to like go in the store because I haven't been to the store in a while. And it got kind of late. It was like 7 p.m. by the time I finished, and we live 25 minutes from the grocery store. So I still had to drive home, and I hadn't eaten dinner yet. So I was pretty hungry, and I was like, I'm just going to grab some McDonald's really quick and eat that on my way home so I don't have to like stop and eat and then like it'd take even longer to get home. So yeah, I did that. And normally I would just get like a burger from McDonald's, but because we were at the cookout earlier in the day, I'd already had burgers. So I decided just to grab some chicken nuggets, and it was like a meal. So some chicken nuggets, fries, and a drink. And at midnight that night, I woke up feeling like I was gonna throw up, basically, and like stuff just didn't feel good. So I went to the bathroom, and sure enough, I got sick. Food poisoning sick, if you're familiar with that, it's not fun. Things just coming out both ends, basically. So that happened like around midnight, and then like around 2 o'clock, and then I think around like 4 o'clock. And I couldn't fall back asleep really because my intestines were just like super crampy. And it's kind of weird, like you can't see my belly, but like, your belly is usually, your belly's right in the middle, and when you're not pregnant, so are like your intestines and everything. But when you're pregnant, belly's in the middle, and then your intestines kind of get pushed to go around. So all that cramping and that pain I was having was like going up and kind of around my stomach. So that was really, really uncomfortable. I could not go back to sleep. I got like 2 hours of sleep that night. Luckily, the next day was Labor Day, and my husband had off work, but he still had to work a couple hours in the morning. He works from home. So he worked a couple hours, and I kind of just chilled with the kids. Like they got to watch a lot of TV that morning and just try to like rehydrate and everything. And I basically spent the rest of the day, once he got done working, just trying to like rest and sleep and recover and drink a lot of fluids. I did call the doctors, like since it was Labor Day, they weren't in the office, but I called their like after hours line or whatever. And I was just wanting to make sure, like I didn't know if I needed to go in and get checked to make sure the baby was okay or anything like that. Because I know they always talk about the risk of listeria with pregnancy and like eating foods that can cause that, but this was just like a regular food poisoning, not at risk or concern for listeria. So they did ask me some, about my symptoms and stuff. Like I don't think I had a fever. They asked if I had a fever. I didn't take my temperature, but I didn't feel feverish. And they basically said if just let it run its course, it should be done within like 24 hours. And then if it gets worse or doesn't stop, then to go into the ER to get checked out. But luckily I was only sick like maybe 3 times that morning, and the rest of the day was just trying to recover. So that was really not fun, but luckily it could have been like way worse, and everything seems to be okay. I went into my regular prenatal appointment on Tuesday then the next day. So that was nice, just to double check her baby's heartbeat and everything. So she was fine. She's still very, very active. Just always active. Very, very active baby. I think that's like most of the medical kind of updates. Like I don't really have a whole lot of other symptoms going on. Just, I guess I have had a little more swelling. It's not like at a concerning level, but I've noticed it in like my legs and my feet, like my lower legs. I've had varicose veins for a while in my lower legs, and I know I can wear compression socks for that, but it's been so hot that I don't even like want to wear any kind of socks, much less like knee-high compression socks. So I do have some though. I've worn them like once or twice, and if it gets really bad, I'll put them on, but it's not like pitting, like pitting edema, they call it. So it's just like a little bit of swelling. And then just in the last couple of days, especially, I've definitely noticed my hands, and it's hard to tell because like it's pretty hot. So I don't know if, I'm sure the heat's exacerbating it, but in general, like I can just feel it feels more tight. But I'm not worried about like my blood pressure or anything. It's not like at a concerning level. And they just asked me about it at all of my appointments. And then, I just kind of let them know as far as that goes, but they haven't seemed terribly concerned about that. So I think that's everything. As far as like symptoms, everything else has been pretty much the same, some acid reflux here and there. Just everything, kind of tired, and everything's a little bit sore. But life update wise, I guess, I don't really have a whole lot of an update, to be honest. I finally found a crochet pattern I'm going to use for the baby hat. I always make a baby hat for my babies so they can wear it like in the hospital for their first picture. I don't do anything fancy. They're just wrapped in their hospital swaddle blanket, but then I have a hat that I made and I keep it in their baby box. So each of my other kids has one. This time I'm going to try making like a bonnet. It was a really cute pattern I found. So this week I plan on getting the yarn to do that. And I also found a pattern I'm going to use to make a baby blanket for my sister-in-law. I guess that's a little bit of an update. My sister-in-law, we went out to New Jersey where she lives, and for her gender reveal, and we found out she's having a boy, which was my guess. But it's funny because we both have, our first kids are only 3 months apart, exactly 3 months apart. I had a boy, she had a girl. And then our second kids, they're further apart because she did have a pregnancy loss, but they're like 7-ish months apart. I had a girl, she had a boy. And now we're both pregnant with our third babies, which are due like 2 months apart. I'm having a girl, she found out she's having a boy. So we keep having the opposite genders. She has girl, boy, boy, and I have boy, girl, girl. Which is just, I don't know, it's kind of funny. That's kind of why I assumed she was having a boy. But yeah, so we're excited for her, and I'm going to make a baby blanket for her baby, like I made for her other kids, just like a little crochet baby blanket. And then my niece, her oldest, actually said her baby blanket is too small now because she's like, 4, almost 5. Baby blanket would be too small. So she wants a bigger blanket. And I said, well, I'm definitely not going to be able to crochet another blanket this year because I just do not have the time for that. But I did ask her if she'd be okay with one of those like fleece blankets where you just like knot the ends, like you tie it. So I think I'm going to try to do one of those for her. I'm going to see about seeing if I can find like a kit to do it at the thrift, or not the thrift store, at a craft store. But if I don't find the fabric I'm looking for, then I might just buy some fleece fabric and kind of make it on my own. I think that'd be a pretty quick, like it's a no-sew blanket. So I think that'd be pretty quick. And then I still need to make a Christmas stocking for my baby, but I don't think I can do that quite yet. I'll probably have to wait like another month until more of the Christmas fabric comes out at the thrift. I keep saying thrift stores. You can tell how much I'm into thrifting because I can't even like think about other stores. At the craft stores, at the fabric stores, things like that, either Joann's or Hobby Lobby. We don't have an AC Moore anymore. There is a Michael's kind of nearby, which I think I'm going to try going to Michael's on Tuesday this week and see what I can find there. I'm not too familiar with their inventory because I'm not used to going to that one. So we'll have to see what they have. But yeah, so I'm kind of getting those things mentally ready. This week is like things are just really starting to pile up. My husband's birthday is this week. And then in like 2 more weeks, it's my son's birthday. And then my nephew's birthday is in October, early October. And then trying to get like Christmas stuff ready because I don't want to be like dealing with that when I'm like about to have a baby. And then just trying to get like the nursery ready. I haven't even started with that. I did find a changing pad that I was super excited about though. We always use those, the basic foam changing pads and you put the cover over it. But after every baby, like when you take the cover off, those things are always like so cracked and like falling apart. And they're usually like around like $30 or something. So, yeah, that's what we had for the last 2 kids. And we had to replace it after each kid. So since our first was going to be born, I've always wanted to get one of those reusable, like wipeable ones, like a Kikaroo or Peanut Changer, Bumbo. I forget, there's a couple brands. Skip Hop makes one, I think. I've always wanted to get one of those, but they're pretty pricey. They're like $60-ish on the low end, new. And I'm just not willing to pay that for something I'm going to change like a dirty butt on. So I've been looking on Facebook Marketplace and one came up that was the Bumbo brand. She was asking $20 for it. And she said it had only been used once or twice. And it was near me. It was only like 10 minutes from my house. So I jumped on that and we picked that up. So I'm super excited to have that so I can pass on the changing pad covers, either donate them, sell them, give them away to somebody, whatever the case is. Yeah, I can pass on those and then we can just easily change the baby on this one and then like wipe it clean when need to, especially because my other babies always had reflux. So they always spit up. We haven't had like a ton of like blowout issues, but we have tons of spit up all the time. So it'll be nice to have it for that purpose and just be able to wipe it clean. So that's really the only big like baby thing I've gotten recently. We just need to finish getting our big kids stuff out of the nursery. So I'm kind of looking this way because their room's like in front of me. But we just ordered a dresser because my husband's being kind of silly. I want 2 dressers to match their beds. They have the exact same beds that we'd gotten on Marketplace, and I want to get, oh, there's a fuzzy. I wanted to get dressers that would at least somewhat match the beds, and I want the dressers to be the same so everything's kind of cohesive. So we found one we're interested in, but he's like, let's just order one to see if we like it and see what, I'm like, we had to wait like a week or so for it to come in. I think he ordered it from Home Depot. So it's supposed to get here on Tuesday. And then we'll see, I guess, how we like it. It's a solid wood dresser, which is ideal compared to like the engineered wood. We'd prefer to have a solid wood one. And then I guess if we like it, then we'll order the second one. So it's kind of like slowing down the process a little bit, but you know, it is what it is. So once we get those in, then I can move their clothes up from the nursery, and then I can kind of finish out like their bedroom as far as like hanging things up on the walls or whatever that we need to. I didn't want to hang anything until we had the dressers in place since they're kind of bigger pieces of furniture. So once that happens, then I should be able to really start sorting out the nursery better. My kids keep playing in there and I really want to like get the stuff out of there. So hoping we can do that soon. I think that's most of what's been going on lately. We haven't, like I said, there hasn't been a whole lot of other baby related things going on. We're just kind of like busy with life in general. My son starts soccer this week. And I just saw in the email that they want us to be prepared to be with your child, kind of like doing the stuff with them. And I'm like, I'm not sure I'm gonna be like the most active parent participant in this. I'll walk with him, but like I'm not gonna be kicking a ball and running around this pregnant. So we'll see how that goes. I'm hoping everything turns out okay with that. We did finally get a message from the coach that sounds like everything's still set to start this week. So hopefully that is the case. I think that's pretty much all the updates though. Really not a lot going on. He goes to preschool. Yeah, everything's been going well other than that. So I'll give you guys a little belly shot bump date. And I think that'll probably be it for this video. So this is my just about 30-week bump. I'm wearing more of a tight-fitting dress today as it is, but it's one of those things where like when I look in the mirror this way, I'm like, it looks big, but I know it's gonna get bigger. But when I turn sideways, it just seems bigger. So yeah, that's the baby bump though. Very, very tight. I guess the other one exciting thing that has just happened is that we found out that my cousin is expecting, and she is my youngest cousin. My mom has a very large family. I think I have almost 30 cousins on that side. She has 11 siblings. So very large family, and this is my youngest cousin. She just turned 22, so she's still like, I can't even believe she's 22. Like in my head, she's still like 15 tops, but apparently she ages just as much as I do. So she is pregnant with her first, and she just found out she's having a boy. So that's very exciting. And I'm trying to see if she wants some of the baby stuff that we're not going to use, because after 3 kids, there's just some things that I know I'm not going to use, and some stuff we could donate, but there's a lot of places around here don't take donations of baby gear. So I'm waiting to see if she wants some of that stuff, and if not, then we'll kind of, I don't know, decide what to do with it, or it'll stay in our attic for a little while, who knows. But I think that's everything for this pregnancy update and for this video. So I hope that you are enjoying following along with my pregnancy videos, pregnancy updates. I know I'm not posting a whole lot right now, and YouTube has just had to become one of those things I'm doing for fun because I enjoy it, and not staying on a strict schedule because I just can't do that right now. I thought about doing like a reselling kind of update video. I know a lot of the people watching this video might not be into reselling, and people watching my reselling videos probably aren't into my baby and pregnancy update videos. So I don't know. We'll have to see kind of how we go with that. I'm still planning on doing a van tour, like a mom van tour. I don't know when I'll get a chance to record that. With everyone being sick lately, I haven't really had a chance to do that kind of stuff. But I'm still just trying to keep up on top of things and get some videos out for you guys, because I do enjoy making these videos. So if there's something specific you want me to make a video about, especially like pregnancy related, since we got 10 weeks to go, let me know, and I'll kind of like jot that down as an idea, pencil that in. I still want to do like a big kids room tour once it's done, probably a nursery tour. I'm sure I'll do a like what's in my hospital bag kind of video, things like that. But if there's something specific you want to see, please let me know. And don't forget to like this video if you do enjoy these kinds of videos, and subscribe if you want to come back for more pregnancy update videos and other mom life kind of videos, a little bit of everything, which whatever I'm kind of putting out at the moment. But thank you guys for watching, and I will see you in the next one.